It's very important for us to communicate with patients through their clinicians. If there is a critical value, if there's an unexpected malignancy, that's particularly what comes up in pathology. They may have biopsied something and maybe not even had a suspicion of what was going to be on that slide, and it's up to us to really reach out to that clinician to find out more about the clinical history, find out if there's anything in the past for that patient, and we can't really render a proper diagnosis if we're not communicating with the clinicians. So it's important for them, and it's also important for us to be able to do our job properly. On a day-to-day basis, we're dealing with surgeons in the operating room. If they are sending a tissue for us to do a frozen section, which is kind of an immediate look at the tissue, sometimes they want to know what the if there's a specific type of cancer present, which may determine what happens for the rest of the surgery, if they're going to do further staging, or sometimes they just want to know if there's tumor left at their margin. All of that requires interaction with the clinician, even though sometimes it may be by a telephone, but being able to let them know what we're seeing on our end and communicate it in a way that they understand, because sometimes they're not necessarily pathologists, so we have to translate what we're seeing on the slide so that the clinician understands what implications there are for them and for the patient.